Mina Aissatou Sise, NTD Sierra Network Canada, the National Emergency Response Center, concerning the press conference where the Ministry of Health and Sanitation go get today on the Lassa fever in the country. We go inside the hall now, outside the conference will take place.
To the Public Health National Emergency Operations Center and for this press conference. And we want to thank you for honoring our invitation. We'll go straight to the program, but before we begin, let's do our usual silent individual prayers. Amen. 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 Okay, we go according to the program now, and we would ask Dr. Aliwuri to give an overview of the support to the incidence of increased cases of Lassa fever in Tonkolili district. Over to you, sir.
Okay, sir. Thank you, sir. Honorable Minister, Lobloa, DCMO, members of the 4 states, good morning. I think on Friday, the 20th, we received information from the Tonkolili District Health Management team informing us that they've just received the information of 2 confirmed cases of Lassa fever from their 2 of their personnel that were sick. And the DHMT then notified the ministry through the Directorate of Health Security and Emergency. And the Director, Dr. Vandi, then informed the CMO and the authorities and immediately convened an emergency meeting that day at 4 p.m. And the team was here up till 7:30 in the evening, deliberating and mapping the immediate response to that call. Because having received the 2 confirmed cases in an area wherein Lassa fever is not prominent of, we take it as a new infection and an outbreak within that locality. But let me hasten up to say it is not a new outbreak of Lassa fever in Sierra Leone. I would like to start from that being this is the 4th estate, that's the media. Lassa fever outbreak in Sierra Leone is an ongoing outbreak, but in that particular locality in Tonkolili district, it's a new one, so we took it very serious, because that's not the usual Lassa fever belt. And having met on Friday, straight away the National Emergency Operations Center was activated. Partners were called, all the relative pillars were activated here at national level, and a decision was reached that a rapid response team was to be dispatched immediately to go and support the Tonkolili District Health Management team. Out of those 2 confirmed results that were received that day, one of them was already evacuated in the Netherlands, and he was already admitted there when it was confirmed. He left not knowing actually that he had Lassa fever. He left with the incident that he was having unexplained fever, and he has been tested for malaria and typhoid negative. But having continued getting sick, it became a concern to the organization where he was working with Masanga management, and they decided to evacuate him for further medical investigation to the Netherlands. And let me say, his evacuation did not pose any public risk, because he was transported from the hospital to the airport through their vehicle, and from there it was a chartered flight, so passed just for his own evacuation. It was only him and the medical personnel that were in that one. So I want to start from there. This first case that we're talking of that was confirmed ignited the response unit, because that shows us that it's an outbreak already. But before that, it was another, two results came. The case of this personnel who is a doctor that you're all aware of now, who we've lost, and another colleague doctor that they operated on a case, which I will deliberate on. And since that doctor was being evacuated at the time that the other doctor started feeling ill, but very stable at the time, they decided to collect her sample as well. And while the doctor was being evacuated, he was evacuated together with the blood sample of the other doctor. And when they tested these two results, they were positive. Those were the results that were sent to the Masanga management that informed the DHMT on the 20th. How did they reach to that? On the 30th of October, a pregnant woman came in to Masanga Hospital as a referral from a nearby community health center, Makontande. Pregnant woman, 30-year-old, came in with abdominal pain, term pregnancy. They saw it normal, very close to I delivery. They admitted for observation, observed that the patient was having high blood pressure and started convulsing. Usually we're linking it to preeclampsia and eclampsia. And one of the indicators for that is a cesarean section. So they decided to operate the woman, the cesarean section. The operation was done. They found that there was a fresh stillbirth, meaning that the child was found dead already, but fresh, which means it was just an immediate death, not a far long death. And they closed up, took the woman to the ward. After some time, she started bleeding. They tried to control the bleeding, but couldn't, and they lost that pregnant woman. That same day she was operated with profuse bleeding. But they never thought of a viral hemorrhagic fever because they were thinking they've got a preliminary diagnosis. But within that same day, another woman came in with incomplete abortion, bleeding because of abortion that started taking place or happened somewhere. And it was not only an incomplete abortion from the report that was given to us, it was, the abortion was already septic, meaning infected. So she came in with, again, fever, again abdominal pain, and the team decided to do a manual evacuation to stop the complications going further. They did the manual evacuation, successfully cleared the product, the fetal products, took the woman to the ward. And this happened the same day that the cesarean section was being done by that first pregnant woman. An hour difference in between. And it was done by the same surgical team. And after that, 4 days after this case that was seen as the second case started developing unexplained high fever again, and became concerned, the team became concerned, decided to do a laparotomy, meaning to open up the abdomen to find out what is causing this issue. And they did the surgical intervention, closed up the patient, took the patient back to the ward, and thereafter again, profuse bleeding. And the woman died on the 9th. The first one died on the 4th. Yet still, the team was relating it to maternal death. So no test was done for Ebola or Lassa fever. Not in fact for Lassa fever, because I believe they are thinking that it is not the usual belt, and this a pregnant woman that came and had complications related to the pregnancy. On the 10th, the lead surgeon that led the team for the surgical interventions on these two women started experiencing some mild signs and symptoms of illness. But it was not severe. He had to come and do a function in Freetown that weekend. He came to Freetown, did his functions, went back to Masanga, and he was there. Then he started becoming ill, and the ailment became of a concern. They decided to do the usual tests. He was negative for malaria, he was negative for typhoid. They continued observing him, but it became of a concern that he was not improving. They decided to evacuate him. And during that time, as I explained earlier on when I started, his assistant surgeon, who is a female doctor, an expatriate, fell ill but relatively stable. So while the lead surgeon was evacuated, he went along with the blood sample of the assistant surgeon, and they were confirmed positive. These two women, no blood sample was collected because at the time they were not relating it to any viral hemorrhagic fever. The cases that presented to them were purely gynecological cases that they handled as such. It was only after those confirmed cases that they started thinking of the viral hemorrhagic fever. And within that time, those two corpses have already been buried. The result came on the 20th, and the first was buried maybe on the 5th because she died on the 9th, on the 4th. The second one died on the 9th. She was buried on the 10th. But when we received these positive results, we straight away knew that those corpses were linked to this surgeon that have got ill. So we link it, and in epidemiology, even when you don't confirm a case with lab and that person died, if you can link that person that died, his or her ailment, to another case that has been confirmed positive, you can confidently say it's a probable case. So we use the definition of probable cases of Lassa fever for those two women that died, because they are linked to the results that have already shown positive. I hope I'm not going too deep. And because of that, we had to trace the pathway of those two women on the way to the Masanga hospital and their corpses packed on the way to the burial. And the team has already been dispatched that is doing that. But let me just explain about the cases we've got first. And after those two probable cases, and after the results coming in and we knew that these are Lassa cases, the surgeons, we then decided to, of course you are familiar with this one after Ebola, we identified their contacts, we traced them, and after identifying them, we listed them, meaning that we had each and every contact's address, name, age, address. So all those contacts, in total, up to Sunday, we had 49 contacts already been identified and traced, and they are presently under observation. And I'm happy to hasten up to say all those contacts of those outside the hospital, we have not yet seen anyone that has developed signs and symptoms. Those that we have isolated are only the health workers that have started developing signs and symptoms. If I can go through the records, out of the personnel that have been confirmed, as I mentioned earlier on, 2 were earlier on confirmed, and unfortunately we lost that doctor that was evacuated. But the other lady that has also been evacuated, the assistant surgeon, is stable. She is the only one that has developed signs and symptoms. The other 8 expatriates that were evacuated for precautionary measures. And I repeat, they were evacuated for precautionary measures. None of the 8 have not yet developed any signs and symptoms. I saw them myself. I was there during the evacuation. They are all stable. They are all healthy when they were leaving, when they were all strong. But their government decided to take them because they are now what we call high-risk contacts. And they want to go and put them in an observation room so that in case anything happens, they'll be able to monitor them earlier. So, not with the exception of the 1 assistant surgeon that was evacuated earlier, those 8 that were later evacuated, none has developed signs and symptoms. And I want to repeat that all of these personnel that have been evacuated, none used commercial flight up to our knowledge from the information we have. They all used chartered flights. The first doctor, the medical insurance sent a flight for him. The second doctor, they sent another flight. And those 8 that are not yet developed signs and symptoms, we are also given a special flight that took only the 8 personnel. Coming back to those other local personnel that got ill, we had one lady, one man who is a nurse anesthetist working for Ministry of Health, who was part of the surgical team that operated on the 2 ladies. And the nurse anesthetist developed signs and symptoms. And because by then we already know that we are dealing with Lassa fever, immediately a rapid diagnostic test was done on him, and later on his sample was taken to Kenema and it was confirmed positive. So because of that, he was also transferred to Kenema, and is presently in Kenema stable, and he seems to be responding to treatment. Another nurse that happened to deal with the 2 corpses developed signs and symptoms. Again, a rapid diagnostic test was done on her. It was negative, but yet still, because she has developed signs and symptoms, we took blood samples, sent it to Kenema. It was negative, but yet still, she is still under isolation and she's been observed. These are the 2 local personnel that we know up to Saturday that were in Kenema. On Sunday, we had a new suspected case by one of the senior nurses in the hospital as well, who also was part of the team managing those 2 pregnant women that died. A rapid diagnostic test was done on him yesterday. It was negative. We collected his blood sample and sent it to Kenema for confirmation. We should be having the result this afternoon. But he too is in a stable condition. He is under isolation in Masanga Hospital. And we'll wait for the lab result to confirm. If he's positive, we'll refer him immediately to Kenema. If he's negative, we'll still put him under isolation and continue to observe until the 21 days. So far, that's for the local personnel. We had one other expatriate who was not in Masanga Hospital at the time those surgical interventions and the management of those 2 pregnant women was going on. He was in the field on mentorship. He's also part of the training team at Masanga. But when he came back, because he was staying with his colleagues and he developed vomiting and diarrhea, we did not want to take chance. So we took him also as a possible suspect, and we did a rapid diagnostic test on him. It was negative, and even when they collected his blood, sent it to Kenema for confirmation, it came out negative. But he too, he is under isolation and observation until the 21 days. The other contact, when the lead doctor that we have lost came down to Freetown on the function, we understood at the time he just started complaining Malay, so we took it, that was the onset of his signs and symptoms. So even when he came and went back to Masanga, we were able to contact the place where he lodged, all the contacts that were with him during the functions, and we have identified all those contacts, we have listed them, and they are constantly under observation until the 21 days is done. That contact is negative, both for the rapid diagnostic test and the lab test from both CDC China here and from Kenema. They are all negative, but she is still under observation until after the 21 days. This is so far for the contacts. As I say, we have now deployed the District Emergency Operations Center has been activated. They have all the pillars now functioning. Some ministers this morning, it is in full activation, and the communities and the partners are in close partnership, working together with the district health management team. All the 3 paramount chiefs in the 3 chiefdoms that are affected have been informed by the district medical officer, and they are all working in collaboration with the district health management team. And so far, the ministry as a central has sent on Saturday, they received the information on Friday. We had an emergency meeting here at this hall up till after 8:30 in the evening, and on Saturday morning a rapid response team was sent from Freetown here to go and support the district health management team, and another rapid response team from the Kenema viral hemorrhagic fever unit was also dispatched to go and strengthen the district health management team. And let me also hasten to inform you that the district health management team has been on top from the day they received the report, meaning that they had been very alert. Immediately they received the report, they went through the protocol, activated, and got their partners on. And by the time we reached there on Saturday, they had even taken steps in identifying those contacts and traced them. And if I can give you the statistics for so far, and please listen because we may not want misquotes. If you don't understand, please ask us for clarification. But if you mistake on one terminology, it may mean quite something else. So far, up to the 24th of November, we have got only one new suspected case that we saw on Sunday. But let me go to the cumulative cases. The total confirmed cases so far are 3 confirmed cases. And all of these 3 confirmed cases are from Tonkolili district. 2 are from the expatriates that have now been evacuated, and 1 is the nurse anesthetist from the Ministry of Health who is in Kenema. The probable cases, I think I took my time to explain probable. When we say a probable case in an outbreak, we mean that that case was not confirmed in the lab, but that case is being linked to a confirmed case. And that case died, even though not confirmed through the lab, but died with signs and symptoms similar to the disease that they have confirmed. That's what we call probable case. We have got 2 probable cases. The index case, that's that first pregnant woman that we are taking as the index case, and the second woman that died on the 9th. These are probable cases because we are very much sure that they are linked to those 2 confirmed cases, but they were not tested for Lassa fever. Well, total suspected cases so far is 3. When we say suspected cases, it means they have either not been tested yet or they have been tested and found out to be negative, but they still have the signs and symptoms. And that's why we say suspected. So those total suspected up to yesterday are 3 suspected cases. So when we combine all these cases that we have in hand, both the probable cases, the confirmed cases, and the suspected cases, we have 8 of cases. Out of these 8 cases, I repeat, only 3 have been confirmed. 2 are those probable cases that died before the result of the Lassa fever have come. So in actual fact, we will say those that we think that they are real Lassa fever cases are 5. That is the 4. No, 5. The 2 probable cases plus the 3 confirmed. So please, let's have it. The 2 probable cases plus the 3 confirmed. That means for surety, what we can tell you is we have got 5 Lassa cases so far that we know for sure these are Lassa. The 3 confirmed and the 2 probable. The other 3 are just suspects. I think so far on the number of cases, that is what we have done. And as I repeated, as we are talking now, we have got all the pillars in now in the field working. We have got the surveillance team that is now out up to the communities in the 3 chiefdoms, working and tracing, still looking out the contacts that we have not yet either identified, or maybe during the investigation a contact may also reveal a contact. So they are still working on that, the surveillance team. We have also got the social mobilization team that is now in the district sensitizing the communities in those 3 chiefdoms. And we have also got another team that comprises of lab technicians. Anywhere they go and we know we have a suspect, they are not just taking you, but they do a rapid diagnostic test on the spot before ever they take the sample for the others. And we also have in the field, as we are speaking, we have a team that is looking for the rodents, the rats, because this is, as I mentioned to you earlier on, that is not the routine Lassa fever belt. But we know that some of these rats that are causing it have been identified in those areas for some time back. So we don't know if the migration of the rats along the road, we have those that are carriers. That is why we have now people there in the field trying to set traps to capture these rats, identify them, and see if they are carriers. So we are looking at all those places to answer some of these questions that may be coming up on how come it reaches there, or how come we have people coming from that area. And we also have an ambulance standby. The Massaga Hospital have already created an isolation unit wherein all suspects are taken there and observed. And we already have an ambulance standby in case anyone is positive, can be transferred to Kenema Hospital. So that is what we've done so far. And we have moved with partners. Partners are also coming in, giving their support. And I don't want to name individually, but I know from the beginning we have partners that have been with us: WHO, CDC, UNICEF, CARE, USAID, and CDC are with us as well, and the other partners, CARE and others. All the partners on board, and even in the district, all those partners working within the district when we went there, they were on board. So this is where I think I can reach so far, Mr. Chair. Thank you, sir.
Good afternoon.
We have lived with Lassa fever as one type of hemorrhagic fevers in Sierra Leone. However, we developed a whole scientific profile of how to deal with hemorrhagic fevers as a consequence of the horrendous experience with the Ebola virus. Where we were in 2014 is a far cry from where we are today in 2019. You have been informed that the key pillars to ensure we are able to, 1, do surveillance, 2, laboratory diagnosis, 3, case management, 4, even track the rodents, have all been in place within Tonkolili district. What we want of you is to calm the fears of the public. That indeed you have had Lassa fever in Sanitation long before now. The difference is that it is now in a district that is not traditional for Lassa. However, only 3 confirmed cases with 2 probable ones. Of the 3 confirmed cases, we feel so bad that we have lost the Dutch surgeon. He was not only a keen medical specialist, he was also the lead trainer for training of our community health officers in surgical skills. As a nation, we will join the people of Netherlands to mourn his death. But as a nation, we are far better prepared to address the situation with regards to hemorrhagic fevers now than where we were in 2014. Be rest assured that all what deserves to be done scientifically is being done. Be rest assured that the ministry, along with its partners, the WHO, the CDC, and all others, would do our absolute best for this not to be an outbreak. These, they are incidences, and we are working for it not to be an outbreak. We would take a few steps. That is to strengthen the IPC measures in all hospitals, apart from the Masanga hospital. We would also take the step to separate out a hearse from an ambulance. We would also take a step to step up sanitation procedures in all health facilities. I think what we are letting the public know is that general hygiene, personal hygiene, food hygiene has to be key for you to live in Sierra Leone. So those food sellers should also note what they do. Those that buy the food should also be very careful, because you are talking about rodents, their urine, checking your food. That is where you would have Lassa from, apart from the exchange of body fluids. So food hygiene is critical, personal hygiene is critical. But this time as a nation, we want people to feel that they should take personal umbrage, personal step in ensuring that they handle their own hygiene status. And as a nation, we will do every scientific step to ensure this does not break beyond where it is as of now. And those that live in those places, we would also continue to note that we have incorporated our linkage with paramount chiefs, because we strongly believe in community participation, community mode of addressing this disease. With that, I will now ask Mr. Harold to officially read the communication.
Journalists and media houses, you know, with the collaboration has been very, very great. We have included you in most of the trainings that we have done, and then we have a network of health columnists and reporters which is very active. And when this news broke out, a lot of you have tried to give sound and accurate information. You know, this is very much important, and I want to thank you very much for that. And we have also used the no regrets policy, meaning we tell people what we know, what we do not know, and we continue to update people as events unfold. So that is the spirit. So with this, I would want to read the press release, and the press release also is also posted at the DHSC website, that is dhse.gov.sl. You can just go to the website for real-time information on updates on the press release and also our situation reports. The Leone Ministry of Health and Sanitation initiates immediate response to increasing Lassa fever cases in Tonkolili district. The Ministry of Health and Sanitation wishes to inform the general public that as a result of the incidence of Lassa fever infection in Tonkolili district, there has been a sudden increase of cases of the disease. 2 probable cases were surgically operated on 4th November 2019 by the medical team. Of these, 2 are confirmed positive for Lassa fever. Among the 3 lab confirmed cases, 1 is admitted in the Lassa fever unit in Kenema district, and 2 have been medically evacuated to the Netherlands as it is their home country. One of the evacuated health workers has died according to the Dutch authorities. The lab indeterminate case, meaning it's in between, neither negative nor positive. They are doing more other tests to ascertain. Is also admitted at the Lassa fever unit in the Kenema district. Meanwhile, a total of 48 contacts have been line listed for strict medical surveillance, including 29 health workers. Lassa fever is an acute viral hemorrhagic illness transmitted to humans through contact with food and household items contaminated by infected rats, that is the Mastomys natilensis, which is the multiple-breasted rat that is responsible, is the host for the Lassa fever virus. Human-to-human transmission can occur in hospital settings in the absence of adequate infection prevention control measures. Healthcare workers are mostly at risk of contracting the disease where the infection prevention and control measures are not strictly adhered or followed. The Ministry of Health and Sanitation is warning all to take the necessary preventive measures. Although we have been cautious of Lassa fever all this while, for the disease to spread through health facility transmission gives the health authorities the cause for concern and vigilance. It is tragic, however, when health workers are infected in the line of duty, says Dr. Ali Wuri, team lead for the Rapid Response Team, Ministry of Health. The Ministry of Health advises all to focus on prevention by practicing good personal and food hygiene and report any concerns about their health or that of others through the 117 toll-free line. WHO, this is a quote from WHO, CDC and other partners are working with Ministry of Health and Sanitation to support the investigation and follow-up of cases of Lassa fever in Sierra Leone, and with health authorities of other countries to share information and provide guidance as needed, says Dr. Evans Leone, WHO representative in Sierra Leone. Whilst the ministry and partners are vigorously working to put the situation under control, the Ministry of Health and Sanitation remains committed to prevent and respond to all public health threats. You can visit the website http://dhsc.gov.sl for real-time situation reports and press releases. For further information at the Ministry of Health, contact Harold Thomas, Communication Lead and Program Manager Health Education, Acting, and the Ministry of Health and Sanitation, at the official mail that is thomas s@dhsc.gov.sl, at phone number +232-760-2460, and at the WHO, the World Health Organization in Sierra Leone, you can contact Mr. Safia Boy, Communication Officer, WHO, and the email, the official email is gboysa@who.int. Telephone number +232-76777-878. Signed, Dr. Amara Jambai, Ministry of Health and Sanitation, Chief Medical Officer. So I want to thank you, and please, you can visit the website for further information and real-time information. Thank you very much. And we will also share the copies with you.
I would like also to take this moment to thank the ministry for acting within 24 hours. That is what is expected from every responsible government, that if you receive notification of unknown disease or a disease that requires this level of attention, that is what is expected of you. For the media, I will also encourage you to communicate responsibly by letting people know what to do in case of such an event. There have been, as communicated, 48 contacts that are being followed, and we will keep monitoring them, working closely with the Ministry of Health, plus other partners that are with us here, CDC, USAID, Public Health England, and many others that I cannot mention all of them. But the most important thing is that we need to strengthen our structures to make sure that we are able to detect all the time any event that occurs on time to prevent any other further escalation. And this is what we are working together. So after this press briefing, I think we will sit in a technical meeting and try to see what can be addressed, as my colleague from, I think, Al Hussein Air Radio said, what should be these immediate measures that needs to be taken, and what should be the long-term measures that we will continue to work on. So this is an area where WHO and other partners, we are going to put all our energy, technically and financial resources from our donor to strengthen. Thank you.
As soon as I listen to the Minister of Health and Sanitation, when Professor Alpha Tijan Wuri, and also the Director of Primary Health Care, now the Ministry of Health and Sanitation, when Dr. Ali Wuri, as they talk about the confirmed case of Lassa fever na Tonkolidi district. Me we carry this program to na today. Me your name na Aissatou Smile Sise. Until we meet again, I say tata.